Good morning, students. Today we are going to discuss about a topic that is serology, which comes under microbiology unit 5. So let's start. The first we are going to see what is the meaning of serology. The branch of serology, it is like the branch where the laboratory medicine that studied blood serum for the evidence of infection and other parameters by evaluating antigen antibody reaction in vitro. It means it is a branch where they are going to do the test on blood, okay, by doing the antigen antibody reaction. The next one is, it is the scientific study of blood serum. In practice, the term usually refers to the diagnostic identification of antibodies in the serum, and we can detect antigen too. So it is a branch, or it is a study of blood serum, okay, where we are going to find out the disease, okay, with the help of antigen and antibody reaction. So what happen in antigen antibody reaction? It react with each other in observable manner, okay, it react with each other in a observable manner. What are the uses? The first one helps antibody mediated immunity, infection and tissue injuries. The second one, it helps diagnosis of infection, and the third function is in epidemiological survey we can use this process. So these are the three uses of antigen antibody reaction. Next, there are some terms what we can see in this. The first one is analytical sensitivity. What is the meaning of analytical sensitivity? It is the ability of a test to detect very small amount of substance. So this analytical sensitivity means it is a test where we can identify very small amount of substance like small bacteria, viruses. Second one is clinical sensitivity. It is an ability of test to give the positive result if the patient has the disease. So it means in the first one we are going to see what virus or bacteria present in the serum. Okay, with that we can find out. But in the clinical sensitivity test, we can find out that the result of the patient is having disease or not. It is the positive or negative, or like this. Like suppose if any patient is suffering from any fever, so doctor, like from long days, like from 10 or 15 days, doctor will advise for blood test, maybe like malaria, typhoid. So in that result it came positive or negative, okay, typhoid, the patient is having typhoid fever or not. So like this, for that we'll go for clinical sensitivity. Next is types of serological test. There are many categories like agglutination test, double diffusion participation test, immunoelectrophoresis, Western blot, and complement fixation test, and immunofluorescence test and immunoassay. So these are the 7 types of serological test. Now we are going to study one by one what is agglutination and other types in serology. The first one is like where the serological can be done on various species. Like some serological tests are not limited to blood serum but can also be performed on the other bodily fluids such as semen, saliva, which has roughly similar properties to serum. In the definition itself, I have told that it is the study about the blood serum, but in all serological tests, it is not limited only in the blood serum. They can go for the test in the semen or saliva also, okay, because they have a similar properties like serum. Serological test may also be focused on forensically, generally to link a perpetrator to piece of evidence, linking a rapist to semen. Okay, this test also used in the forensic department, like in case of any rape, anything, to find out the like the rapist, okay, they will go for this test, okay, serological test with the collection of semen from the victim body. Okay, now first we will see about the agglutination test. See, if you go for this picture, this small round shape is called as antigen, and this one is called as antibody. Okay, so what happened in case of positive result, agglutination test is positive, okay, you can see this picture, and in case of negative you can see this picture in the slide if you go for test in the lab. Okay. The agglutination test, it is the aggregation of particulate matter caused by the combination with specific antibody. In 1896, first observed by the Grover and Durham when serum antibody was found to react with the bacterial cell. Okay, so it was first established on the year 1896 with two scientists, that is Grover and Durham. How they have found out? With the help of the serum antibody, that they have seen that it can react with the bacterial cell. So antibodies that produce such reaction involves in two steps. One is sensitization or initial binding. One is lattice formation or formation of large aggregate. Lattice means, see, it will make like wood strip. Okay, wooden strip structure. With that, it has a two process. Types of particles that participate in such reaction are erythrocyte, bacterial cell, and inert carriers such as latex particles. See, if you go for these, there are like tube agglutination. There are so many types of agglutination. In that, one is tube agglutination test. So agglutination and no agglutination. So how we will find out the difference? Okay, in case of agglutination, it will be like this. There is no particles or there is no lattice will form. But in case of no agglutination, that will be formed with that lattice. Okay, and this is the negative result. In this case, the titer is 1/40. Next type is direct agglutination. The test patient's serum against the large cellular antigen to screen for the presence of antibodies. An antigen is naturally present on the surface of the cell. In this case, antigen and antibody reaction form an agglutination which is directly visible. Next we have slide agglutination test. See, there are so many categories, okay? Tube, direct and slide. It is used for stereotyping, that is example Salmonella, an antigen isolated Salmonella in suspension, an antibody specific antisera against Salmonella. Place the test Salmonella in a drop of saline on a slide. Add a drop of antiserum, mix and rock slide for the approx 1 minute and examine for the agglutination. Other direct agglutination are the particles antigen may be a bacteria. Example is stereotyping of E. coli. Okay, Salmonella using a specific antiserum. And the particles antigen may be a parasite. Example, serodiagnosis of toxoplasmosis. The particles antigen may be a red blood cell, okay, or RBC, and determination of blood groups. And there is a one more test, that is Coombs or antiglobulin test, okay, which is used in case of detection of anti-Rh antibody, okay, or autoimmunity. Detection of anti-Rh antibody means in our blood group we has Rh factor. Suppose if your blood group is A positive, okay, A is your blood group and R positive is your Rh factor. So in some cases, like if the mother is having positive Rh factor in baby is negative, or mother is having negative Rh factor or baby is Rh positive, in that case to find out the anti-Rh antibody we will use this Coombs agglutination test. So in the Coombs test also there are two categories, one is direct, one is indirect. So in the direct one, the patient sample they will collect and they will go for the Coombs with the help of Coombs reagent, okay. And that what happened, example, the baby sample is positive for the presence of a mother antibody on the surface of RBCs in the erythroblastosis fetalis, okay. Next, in the Coombs antiglobulin test, it's incomplete antibody, and direct Coombs test detects antibody on the erythrocyte. So what happened? It can detect the antibodies in the erythrocyte. And indirect Coombs test detect the anti-erythrocyte antibodies in the serum. So there is two difference in the direct and indirect Coombs test. So one, they can detect the erythrocytes, one that can detect anti-erythrocyte antibodies in the serum. So next is indirect Coombs test. So in the steps 1, that is patient RBC, that is serum, then patient sample, okay, Then they will go for steps 2, that what we got with that they are going to use the reagent, okay, indirectly. In the first one, directly sample and reagent we are going to do the test, but here we are going to do the test in a 2 steps. Okay, example, a mother who is having Rh negative can have a prenatal testing to determine the presence of non-agglutinating antibody in her bloodstream that will attack the fetus RBC if the father is Rh positive. Okay, so this is the 2 important test which is mainly used for the detection of Rh antibody in the mother. Okay, next one is passive agglutination, an agglutination reaction that employs the particles that are coated with the antigen not normally found in the cell surface, and the particles carriers include RBCs, polyesters latex, bentonine and the charcoal. Okay, and passive agglutination has been used in the detection of rheumatoid factor. Okay, already you have studied, it is a autoimmune disorder, anti-nuclear antibody in this leukemias disease, okay, and antibody to group A Staphylococcus antigen and antibody to Trinella spiralis. So with this we have completed the one serological type, that is agglutination test. Remaining we will see in the next class. Thank you everyone.